call the meeting to order at 10:06 for the Dietitians Advisory Board meeting. And want to make sure that everybody remembers to mute your microphone and only turn them on when you're going to speak. And the same rules apply. Every time you get ready to speak, please announce your name so that the names can be recorded. All right. So good to see everybody's faces. It's been a long time. We'd like to do the roll call now. And Halika, will you do our roll call for us?
Yes, ma'am. Irma Gutierrez.
Present.
Letty Moreno Brown.
Present.
Leanne Skinner. She's absent today. Susie Weems. I know she's on here.
Present. It just was not on
took you off. Okay.
Sorry.
You're good. Gracie White. Miss White. I'll come back to Miss White. I know she's having some difficulties. Miss White, do you want to give me a thumbs up if you can hear me? That you're here? Okay. Kay Vavrina.
Present.
Laura Kaczynski.
Present.
And Kawana Young.
Present.
And presiding officer Janet Hall.
Present.
All right, you have a quorum.
Great, great. We are so lucky to have 3 new board members on our WebEx today. And so I'd like to introduce them and maybe have them say a few words about themselves so we can kind of virtually get to know them just a little bit. So the first one is Kay Vavrina.
Hi, everyone. I'm Kay Vavrina. I am currently the cystic fibrosis dietitian at University Health in San Antonio. I am a native Texan. I was born and raised in Houston, and somehow I actually have lived all over the country, but I kind of ended up back here. So I've been in this position for about 11 years, and I am your newest clinical member. Nice to meet everyone.
Welcome, welcome. All right, Laura Kaczynski.
Hi, good morning, Madam Chair and board members and staff. My name is Laura Kaczynski. I am a new member to this board. This is my first meeting. I'm really happy to be here. I hold the public member spot, or one of them, and I am a non-practicing attorney. I have had formerly more than 15 years of practicing administrative law, including for the Texas Department of Licensing and Regulation.
Very good. Well, welcome. Kawana Young.
Hi, good morning. My name is Kawana Young. I'm a native Texan also, from the Dallas area. I live in Lancaster currently. Currently, I'm an executive director of MSL Healthcare. I received my MBA from Texas Women's University. Been in the healthcare field for over 20 years. Last 5 years, probably long-term care. Just very happy to be here.
Well, great. Well, we are so lucky to have these 3 new board members. Welcome. All right, let's move on to agenda item number C. And Senior Assistant General Counsel Wendy Pello is going to give us an open government training update.
Good morning, board members. Wendy Pello, Senior Assistant General Counsel. As the presiding officer stated, we'll be giving an open government training. This is something that we do periodically, just as a refresher to all the board members, and then as an introduction to our new board members about how the open government works in terms of being on an advisory board and identifying laws and that are applicable to our advisory boards to help govern our meetings and help you in terms of how to govern in terms of your role on the advisory board. Folks that may be coming from private sector or not in the government may not be familiar with some of the structures and the requirements and the limits that in terms of conducting open government meetings and requirements about rulemaking and Public Information Act. So we do want to provide that type of training to you. I'm going to share. a moment. Just and are you all able to see my screen in terms of the presentation?
Yes, ma'am.
Yes.
Okay, just to make sure you're all seeing what I'm seeing. Since I'm looking at my screen, I won't see any hands. So if you have any questions, feel free to jump in, or we can ask at the end. I'm also available, if you think of questions after the meeting or as we go, during your service on the board, always feel free to ask as well. So 3 things we'll be talking about today in terms of the training is in terms of the Open Meetings Act, the Administrative Procedure Act, and the Public Information Act. So starting with the Open Meetings Act, we're doing is basically the purpose is open meetings is to ensure we've got open and transparent government. And this requires meetings of government bodies to be open to the public and to be preceded by public notice of the time, place, and subject matter of the meeting. And these requirements are mandatory, and the act is construed liberally in terms of favor of open government, and so being transparent.
Wendy, real quick, are you clicking through the presentation? Because I don't see it.
Did we lose the presentation?
I just see like the PowerPoint and then the slides on the left and then the main screen or the main slide. But if you're clicking through it, I'm not seeing it. Okay.
Okay. Are you seeing it now?
Yes.
Yes.
Is there a way to make the presentation just a little bit bigger? It's cutting off.
Wendy, I'm sorry, if you have it on a dual monitor, we're only seeing the one that has the working document. We're not seeing the actual presentation.
Okay.
Oh, oh,
So what are you seeing now?
Nothing's being shared at the moment.
Okay.
Do you want to send me the PowerPoint, Wendy, and I can pull it up? Or do you think you got it?
Let's do that. It's saying it can't display this. So let me send this to you. Apologize for the
I apologize.
technical issues we got here. Are you seeing anything at the moment?
No.
Mm-mm.
Okay. And Helen, can you tell me when you receive it?
Yes, it will. Not yet. I apologize, board members. I'm still waiting for the document to come through. Nothing yet. Oh wait, I think it may have come through. There we go.
And Angelica, did you receive it?
I'm working on it right now. Make sure I'm doing the right one. Okay, can everyone see it?
Yes.
Okay.
Thank
Yes.
you all. All right. Thank you all for your patience through our technical difficulties. As I was saying, this is our training overview. And as mentioned, there's three acts we'll talk about. Open Meetings Act, the Administrative Procedure Act, also known as the APA, and the Public Information Act. We move to the next slides about the Open Meetings Act. Go to the next slide. Again, we're construing this act is construed liberally in favor of open government, to make sure that we're providing notice to the public of public meetings, making sure that they know time, place, and the subject matter that will be discussed during those meetings. And so that's that notice. Go to the next. And just are the members, are you all able to see?
Yes.
The screen? Okay, just make sure you're all able to see that. Okay. Some key concepts on this in terms of our thinking about the Open Meetings Act is a quorum. And a quorum is a majority of the members of the advisory board set out in the statute or rules. For the Dietitians Advisory Board, we have 9 members set out in the statute, so a quorum would be 5. And basically, you need a quorum of the governmental body to meet and take action. If we have less than a quorum, then there can be a discussion, but no official action can be taken. This next slide on deliberation. If you can go back just one more, thank you. Deliberation is basically just a discussion in terms of just series of discussions, and it can be in writing or it can be verbal, and just discussing among a quorum of the governmental body or between a quorum of the governmental body and an outside person, having deliberations or discussions about matters that are under the jurisdiction of the governmental body. You move to the next slide, please. Thank you. And then meetings, and this is anytime that a quorum of the governmental body meets and deliberates or discusses businesses before the advisory board. And in this kind of structure, obviously, we've called the official meeting, but meetings need to be mindful that it can be at any time. So it doesn't necessarily have to be officially called meeting to actually qualify as a meeting in the Open Meetings Act. You can go to the next slide, please. And notice, and here's another key concept, and this is notice is making sure that we provide written notice to the public, again, date, time, place, and subject matter of the meeting. We do this in the form of the agenda. You see that on today's meeting. We're required to file that along with other state agencies. We've required to file it with the Secretary of State office. We also post it on our Taylor website, and we have a GovDeliver email service that people can sign up to receive notices of that as well. And basically, we need to be mindful of what's the notice is, what's on the agenda is what we will be discussing. And so we can't engage in discussions about subjects that are not included on the agenda. Next, please. Thank you. And here's just an example. We often get questions from different advisory boards just because you're all in a similar profession. You may see each other at conferences or conventions, and can we talk to each other? Do we have to avoid each other? And it's like, no, you don't have to avoid each other. You just need to be mindful of any conversations that you, if you've got a quorum member, that you are not discussing advice board business in those types of settings. Advice board business needs with a quorum of members needs to be discussed in an open meeting like we're having today. So just be mindful of that in social events, conferences and stuff, that you've got a quorum members, don't let those conversations don't have conversations about advisory board business, but you don't have to avoid each other at those kind of conferences. So you do the next slide, please. So just some key points to remember. Always be aware of kind of the situations occurring outside of a properly noticed meeting, and just in terms of where you've got a quorum of members present, and don't engage in those substantive conversations relating to board business or policy or make any decisions outside an officially noticed public meeting. And that last bullet is beware of the walking quorum. Let me go to the next slide with the walking quorum. And walking quorum means basically you have fewer than members of a quorum. So like in work groups, or if a couple members are talking to each other, you don't have a quorum at that point, and that's okay. But what happens is the conversation walks to other people, because then you've passed along those emails, or you've passed along that conversation to other members on the advisory board, and so you've walked yourself into a quorum. So the initial conversation or discussions may not have had a quorum, but then they become that. And that's one of the things we're always mindful when we have work groups. We always find work groups with less than a quorum of advisory members, so you can have those discussions, but we always warn the work groups, do not discuss this with other members on the advisory boards till we're back here at a full advisory board meeting that's properly noticed, and you can have those discussions there. That way we don't end up into walking quorum issues and end up with violations of the Open Meetings Act. You go to the next slide, please. And this is just, it shows an example of kind of that situation where if you, an example with the 5-member advisory board member board, where 2 members have the conversation and then pass along that, forward that conversation or those emails exchanges to another member. And so then you've got the walking quorum. So that's an example here. And again, for this advisory board, we have 9 members, so a quorum would be 5. So you can go ahead, go to the next slide, please. Thank you. And just be mindful, walking quorums can occur in a variety of settings. Traditionally, conference calls and video conference, always discussions, but they also be emails, texts, and then as with social media, various social media platforms, that can also occur if you're posting discussions that can be seen by others and weigh in and have an exchange of discussions. So you can go ahead and go to the next slide, please. So there's just some best practices to avoid a walking quorum. Should not, meet in small groups, have discussions, and then forward those kind of communications on to other members. Don't send emails or messages to members of the board regarding board business. And it's not just, okay, I didn't send a group email, but you sent individual in emails. Don't do that. Just make sure that you're having those discussions here at the full advisory board. And the other thing is that the last note is kind of polling, and it's when you're asking the members of the board how they think about how they're going to vote about something. Even if you're doing it on an individual basis, you can't do that as well. So we'll go to the next slide. So just keep those in mind. And then guidelines for open sessions. And this is a board needs to, again, it has to have, only discuss those items that are specifically on the agenda. So during that public meeting, you need to make sure that kind of keep the conversations on those topics, and don't let those conversations wander off into, you can have good conversations and the conversation evolves and it wanders off with the agenda item. So we'll just make sure we're mindful of that we're staying to the agenda. And if an issue comes up that it's like something we want to talk about, put it on the agenda for the next meeting to have a full discussion, and that way members of the public have notice of that. And so you also have members of the public may raise issues of subject that's not on the agenda during the public comment period. We can't respond at that time. we want to put it on a future meeting or send it to a work group, but can't respond at that point. But it's not that there's never a conversation about those topics. It's just we need to make sure we've provided the public adequate notice of this is what we're going to talk about. So you can go to the next slide, please. And so again, just to avoid, having any issues in terms of, with the staying on topic with that, is just limit the discussions again to the agenda items, avoid discussing items that, that aren't posted. Make sure that it's, if there's some issues you want to talk, we can put it on the agenda for the next time, for the future agenda to have that discussion. Go ahead and go to the next slide. And there are civil penalties and there's criminal penalties for violating the Open Meetings Act. So civil penalties, any action we take that violates the Open Meetings Act, that action is subject to being void, and it's voidable, which means if it ends up being voided, then you have to start over. And if that action is no longer stands, then you would have to start that process over again. Move on to criminal penalties. There's also criminal penalties for members who knowingly participate in walking quorum or knowingly meet in a meeting that's not properly that's closed to the public, not properly noticed, and those penalties relate to fines, jail time, or both. So you can move to the next slide. Yeah, so board meetings, again, just make sure you're not having any conversations with the quorum members outside of a properly noticed meeting, and then just during the open meeting, stay on topic with the items that are on the agenda. You can go to the next slide, please. And we have resources here. We have the same resource listed in your materials as well, in terms of the Attorney General's office has a training information and a video that's helpful. Also, we've put they have a handbook. We've listed the site to the statute, and then there's the phone number for our General Counsel's office if you have questions. You move to the next slide. We're going to next talk about the Administrative Procedure Act. Next slide, please. And this is basically, this applies to all state agencies, and it's basically establishing kind of uniform standards and practices, procedures for state agencies. And one of the elements that it addresses as part of the APA is rulemaking and providing for public participation and transparency during the rulemaking process. Next, please. And just a definition of rules, any statement of general applicability made to state agency, basically we're implementing, interpreting, prescribing law or policy, and it's describing the procedure practice requirements of a state agency. And they're applying for general applicability of like how the agency interacts with the licensees and the public, and those type of procedures what we needed to do. You can move to the next slide, please. But it's not internal, just TDLR's internal processes of how we're doing that. So, and the rule can be either a new rule, an amendment to an existing rule, or repeal of an existing rule. We'll move to the next, please. And we have a variety of sources of rulemaking. You can be legislative changes coming out of legislative session. If there's bills that pass that need to be implemented, advisory boards, obviously we get suggestions from our advisory boards and kind of your all's experience, issues that you're seeing that may need addressed, TLR staff, the 4-year rule review, which we talk about here in just a moment, and then a rule petition. And then you go to the next slide, please. The rule petition is any interested party can make a request for an agency to adopt a rule, and the statute sets out who is an interested person for purposes of the rule petition. Texas resident, business located in Texas, a governmental subdivision in Texas, or a public or private organization located in Texas. So they make that request too as well. So we've got a variety of sources of ways rules making can come about. You can go to the next slide, please. This slide shows just kind of a very high level review of kind of that rulemaking process, starting from the upper left corner and kind of following the arrows across. The 2 blue boxes there are kind of where the advisory boards and where TLR puts the advisory boards in our rulemaking process for the first meeting and the second meeting. But basically, this is setting up the process from initially having an idea for a rule, having internal discussions and analysis, going to the governor's office, coming to the advisory board for your first meeting, getting the advisory board's input and recommendations, going to publish, submitting that to the Texas Register, having publication, 30-day public comment period, kind of reviewing those comments, and then coming back to the advisory board, in most cases coming back to the advisory board for second meeting, just to review those proposed rules again and any public comments are received. And then from that, advisory board making recommendations to our commission who would adopt those rules and file those, and those rules being effective. So again, this is kind of a high level review of that. There's a lot of steps that are, a lot of details under each of those boxes in terms of getting the rules adopted. But we do, for TLR, we definitely want to include our advisory boards. And so, like I said, those two blue boxes are highlight kind of where the advisory board plays in the process. You can go to the next, please. And this is the 4-year rule review process. Again, a high-level view. This is a process every state agency is required to review the rules every 4 years to make sure, are the rules still applicable? Do they still, are they obsolete or not? Did the reasons why we adopted, they still apply? We propose a notice of intent to review to the public, letting them know we're undergoing this 4-year review. We're not proposing any specific text, any specific changes. We're just getting feedback. And so the feedback we get from the public, the department's review of the rules, we'll take those rules to the commission where they can be considered for readoption. And any suggestions that come up out of that process, whether it come from the public or the advisory boards or the department staff and reviewing it, those changes would be considered, and if they want to move forward, it would be included in a future rulemaking. So it wouldn't be part of the rule review process. The previous slide that we saw, we'd go through that rulemaking process to adopt those changes. But this is a way to make sure the agency is like, yes, these rules are still current. These are the process and procedures we're still using as well, and making sure that they're adopt the rules and put them on the shelf, and that's they're not used again. So it's a way to make sure everything's still current. And you can move to the next slide, please. And again, we've got a list of rulemaking resources, whether from the AG's office without rulemaking. We've got the applicable statutes. We got sites to the Texas Register where the proposed rules and adopted rule notices are published, and the Texas Administrative Code is where the final rules are housed, and again, our number to the General Counsel's office. And finally, moving on to the next is the Public Information Act. This, you can go to the next one, please. Yeah, and this is making again open government transparency, making sure that the public has access to knows what the government is doing and the steps it's taking. It's making all documents, records, and information open to the public with certain exceptions. It includes all kinds of documents, communications as well, regardless of where the device is, and it's about agency business. And basically, it's again being construed in terms of being open. Yeah, the next slide. And basically, the response or the request for public information, someone can submit a request for information or come to want to review the documents. That request has to be in writing. For TLR, we have a TLR Record Center. It's online. It's on our website where someone can submit a request for information, written documents, and then there is a timeline, and it's set out in the statute. The agency has to respond promptly, but no later than 10 business days to that request. We can't ask why somebody wants it. We can't ask for clarifications if the request isn't clear, but that would be done through our open records team that does that. You can go to the next slide, please. Like I said, the general rule is the documents are open. There are numerous list of exceptions in the statute. Some of those are automatic. We have to redact or withdraw, cross those out, and things like date of birth, email addresses, medical information, credit card information. There's certain things that are automatically that we redact. Any of the other exceptions, we would have to get a ruling from the AG's office whether to keep that information confidential. And so during that 10 days, we were gathering the information and making a determination if just does any of this information fall within exceptions? Is it the ones that are automatically need to be redacted, or the things that need to have a request? So you move to the next slide, please. And why this is relevant to you as advisory board members is that as an advisory board member, someone may ask you for request copies of information that you need to pass that written request on to the advisory team, and Helica, who will get it onto our general counsel's, our open records team, so that they can process. And we want to remind you of that just because you may, like, folks may know you're on the advisory board. You don't handle that. Just pass the request on to us, and the agency will handle that. But letting you know that the 10 days still applies. Business day deadline still applies in that situation. So that's why we ask that request that you promptly respond to, pass that information on, and then promptly respond if our open records teams reach out to you to request documents that you may have. And then move to the next slide, please. And again, we've got resources on this as well with from the Attorney General's office, their information and videos, handbooks. And again, you can always ask the General Counsel's office. And that concludes our kind of open government. I know it's a lot to digest all at once, but just kind of, you've got resources in your materials as well as references for later. Any questions? Thank you, Angelica, for driving. I appreciate it.
Yes, ma'am.
All right. Well, thank you, Wendy. If nobody has any questions, we'll move on to the next agenda item. It is approval of our minutes. So the board should have received the minutes from January 16th, 2020, and it's in our meeting materials that were sent earlier. Do we have any comments about those meetings? I mean, about those minutes? All right. Well, if we don't have any comments, can I get a motion to approve the minutes as presented?
I so move.
Do I have a
I
second?
second. I second.
Second it.
So it's kind of silly, but I need to remind you all to say your names first
Oh.
before. So could
Susie.
we do
Sorry.
that
Susan
again?
Williams.
Ms. Weems made the motion. I believe it was seconded by Ms. Gutierrez. Is that correct?
Yes,
Correct.
Irma Gutierrez, sorry.
So sorry.
It's been too long, Janet.
I know. So Angelica, will you go ahead and do a roll call vote for us?
Yes, ma'am. Irma Gutierrez,
Aye.
Letty Moreno Brown,
Aye.
Miss Susie Weems,
Aye.
Grace White, Miss White, can you hear us? I can't hear you, but I can see your, I did hear you say aye. Yes, okay, good. Kay
Did she do a
Beverina,
thumbs up?
she did.
Aye.
Laura Kaczynski,
Aye.
Kawana Young,
Aye.
and Presiding Officer Janet Hall.
Aye.
Motion passes.
Thanks, Angelica. Appreciate it. All right, we'll move on to our next agenda item, which is public comment.
Aye.
So our board should have received,
Grace.
somebody have,
Yeah, I'm trying to mute someone. Okay, sorry, it was one of our public commenters had their mic on. Okay, go ahead. Sorry about that.
okay. Oh, that's all right. That's all right. So as board members, you received 6 of the email public comments, and now we're going to hear the public comments live for 4 additional people. And so at this point, you're going to bring somebody in from the lobby.
Yes, so we currently have Dr. Hurd, Mr. Bromwich, and Mr. Cairns. Is that correct? Okay, we did not hear, or Miss Boner has not logged in, so we can.
Okay.
So if you want to start with Mr. Cairns, he's the first one on your script.
You bet. You bet. Is he on?
Yes, ma'am.
I am.
Okay, great. Thank you, Mr. Cairns, for being here. So remember, when you speak, you need to say your name and who you represent. You'll have 3 minutes to speak. And so please understand that the board members are not allowed to ask questions or engage in a discussion with you. Do you understand these instructions?
Yes, ma'am, I do.
Great. All right. You have 3 minutes, and Angelica will keep time. So go ahead and start when you're ready.
All right, thank you. My name is Sean Cairns. I am currently a certified nutrition specialist practicing here in Round Rock, Texas. My wife and I own a small group practice where we combine therapy with nutrition for our clients. I wanted to speak today because of the option or the discussion to have about the licensure pathways. I know that we've had the updated dietetics requirements for a master's degree for dietitians through an Ascend program. And being a CNS and looking at the current and former dietetics requirements for licensing here in Texas, our pathway satisfies all of those, with the exception of being from an Ascend accredited program. We are the American Nutrition Association or Board of Nutrition Specialists, Certified Nutrition Specialists, are both accredited by the same accrediting agency. And when it comes to practice, I see with our training, we have to have 1,000 hours of supervision. We have to pass a board certified exam. From an education requirement, CNSs have to have a master's degree or above mandatory, and have since they started with the certification process. And I really see us on equal footing with dietitians when it comes to the services that we provide here in Texas and across the United States. I think really what it boils down to is in Texas, being able to have a strict, single, kind of unifying way to get licensed, whether you're a dietitian or a CNS, as long as you meet the education, the supervision hours, and the exam requirements. Being able to have multiple pathways, right, for licensure. Where it really hurts us CNSs versus dietitians and when it comes to being able to get credentialed by insurance. There are some that will credential us here in Texas, and some, because there is not a state license, will not credential us unless we are registered dietitians. And so it limits the access, right, to quality nutrition care for the people that are around us. And I'm speaking from a unique lens because as a male in this profession, right, there's not a whole lot of us around. And so those that are looking for a male and need to use their insurance, we're really doing them a disservice by not having that option available, right? And I end up finding myself giving very discounted rates just so people can have access to my services. And so it
Mr.
really
Cairns,
just
your time is up. I'm sorry.
Sorry, it's okay. I'm going to finish up here. I really just would like to ask the board to seriously consider at this time, opening up that licensure pathway so we can offer more services to our clients. Thank you.
Thank you, Mr. Cairns. Appreciate your comment. All right, we're going to move on to our next public guest, and that is Dr. Danielle Hurd. So Danielle, when you start speaking, be sure and state your name and who you represent, and that you have 3 minutes to speak, and understand that our board members cannot ask questions or engage in discussion with you. Do you understand these instructions? Can you unmute your microphone?
You're muted.
Can you hear me now?
Yes.
Yes.
Yes,
Yes.
I understand.
Great. All right. Well, you have 3 minutes, and Angelica will keep the time. So start when you're ready.
Hi, my name is Dr. Danielle Hurd. I'm a doctor of clinical nutrition and a certified nutrition specialist. I hold a Master of Science in Human Nutrition degree from the University of Bridgeport and a Doctor of Clinical Nutrition degree from Maryland University of Integrative Health. I have a small nutrition practice and have been practicing for 17 years. I'm licensed in 5 states, Maryland, New York, Washington, D.C., Florida, and Alaska. I currently am a provider on 20 health insurance plans, which includes Medicare. My public comment is in support for creating a non-registered dietitian license. The current license that registered dietitians have provides title protection only. I would like for the Texas Occupation Code to be updated to include a title protection for certified nutrition specialists. During the Dietitian Advisory Board meeting on May 3rd, 2018, which was 6 years ago, my CNS colleagues and I requested a non-RD license for CNS. We expressed the financial economic hardship that we experience because we don't have a state license. The title license that RDs have provides them with more professional recognition, job opportunities, and the ability to be recognized by insurance plans. CNSs regularly experience ongoing provider discrimination and rejection, though we have master's or doctorate degrees with advanced training and skills in clinical nutrition, and CNSs meet the requirements to provide medical nutrition therapy as outlined by Centers for Medicare Services. The healthcare industry is very regulated, and though our Texas government might think that less regulation is best, it is very difficult to work professionally in the healthcare industry without a state license. RDs know this very well. CNS has currently experienced the same issues that RDs have had in the past and in some states still experience. Without a state license, we cannot get hired by most healthcare companies, and it is very difficult to credential on health insurance plans. Though I am currently contracted with all major insurance plans, it took me many years and thousands of hours of my time filing a lot of complaints and the involvement of my Texas representatives. The provider discrimination that I have experienced for many years has been unfair, financially damaging, and awful, and it's ongoing. I'm here today because I don't want other CNSs to have to go through what I have experienced. Our education and credentialing took many years and hard work to obtain and was costly. We deserve to be able to work professionally in the healthcare industry too. There are over 30 million people living in Texas, and there is a great need for more clinical nutritionists in the field. The lack of a state license has prevented CNSs from many professional opportunities and caused many to experience economic hardship. I respectfully ask for you to recommend to the that the Texas Occupation Code be updated to include a non-RD license or
Time is
title
up.
license for CNS. Thank you so much. Contracted with all major insurance plans. It took me many years.
Thank you, Dr. Hurd. I appreciate your comment. All right, next is Mr. Bramich.
Real quick, Ms. Hall, after Mr.
Yes.
Bramich, Ms. Boner did join us, but we can
Oh,
go
she
to
did.
Mr. Bramich. Yes, so we'll do Mr. Bramich first, and then we'll go to Ms. Boner.
Okay, great. All right. So, Mr. Bramich, you've already heard this before, but let's go over it. Be sure and state your name and who you represent. You have 3 minutes to speak. And please understand that board members are not allowed to ask questions or engage in conversation with you. Do you understand these instructions?
Yes.
You have 3 minutes, and Angelica will keep the time. So please start when you're ready.
All right. Good morning, everyone. My name is Chris Bramick, and I'm here to represent myself. I'm a certified nutrition specialist practicing in Fort Worth, Texas. And I'd like to thank all of you for your work in the field of nutrition and dietetics in the state of Texas. And also thank you for allowing me to speak this morning. I would like to ask for the Dietitians Advisory Board to support a pathway to licensure for non-RD nutritionists. As you may know from a letter I sent yesterday and some other sources, my credential can only be gained through a master's level education at an accredited university, followed by a national board exam and 1,000 supervised hours. Allowing people of my specialty to become licensed would provide those of my profession with greater visibility and greater professional standing so that I can help my fellow Texans. I said in a letter that I submitted for public comment that as of 2018, there was only one RD for every 5,000 Texans. And we know our state has grown a lot since 2018. So I believe it would be beneficial to decrease that ratio so that more Texans will seek out access to a parallel group of nutrition professionals who specialize in things like prevention and longevity. So I would appreciate the board's cooperation and support in providing a pathway to licensure in the state of Texas for the Certified Nutrition Specialist credential. Thank you for your consideration and for allowing me to speak.
Thank you very much, Mr. Bramick. I appreciate your comments. All right, next we have Ms. Bodner. Welcome. Thank you for being here. And when you talk, be sure and state your name and who you represent. You have 3 minutes to speak. And please understand that the board members are not allowed to ask questions or engage in discussions with you. Do you understand these instructions?
I do. Thank you so much.
You bet.
Good.
So you have 3 minutes, and Angelica is going to go ahead and keep the time. So please start when you're ready.
Good morning, everyone. My name is Ilana Bodner, and I'm a volunteer representing the American Nutrition Association, along with the Board for Certification of Nutrition Specialists, which certifies the Certified Nutrition Specialist, or CNS. The CNS is the most advanced certification for personalized nutrition practitioners and is backed by rigorous science and empowers practitioners to deliver personalized medical nutrition therapy, enhancing health outcomes. Today on the agenda is the topic of the inclusion of a non-registered dietitian pathway to licensure, which our CNS professionals are eager to be a part of. Amy Smith, the Senior Director of Certifications and Advocacy at the American Nutrition Association, has already submitted a detailed written commentary highlighting the congruence between the RD and CNS qualifications, particularly in terms of educational backgrounds, examination standards, and professional experience. Introducing a non-RD pathway to licensure in Texas will not only broaden access to traditional care in Texas, but also enables CNS professionals to be paneled with insurance providers. This inclusion will improve health outcomes for the state's most vulnerable groups and offer CNS practitioners expanded opportunities to practice within the state. Enhancing licensure access means that more Texans will have direct paths to preventive health care and management of chronic diseases through tailored nutrition plans. This will contribute to a decrease in healthcare costs, improved public health, and a stronger healthcare workforce equipped to tackle nutritional issues with the highest standards of care. Integrating CNSs into the healthcare system is a strategic move towards a more inclusive and effective healthcare model, which ultimately benefits all Texans. Amy Smith is happy to answer any follow-up questions the board may have as this discussion moves forward. And the ANA looks forward to partnering with you to include a pathway for licensure for our practitioners. Thank you so much for your time.
Thank you, Ms. Bodner, for your comment. Appreciate it. All right, so we're going to move on to agenda items F, staff reports. And the first one is Leonard Rivas with Licensing Division.
Good morning, advisory board members. My name is Leonard Rivas. I'm the licensing, the licensing manager for the dietitian program. Welcome to our new advisory board members. Thank you for taking the time to be here with us today. For the new advisory board members, I will give a brief overview of what the report represents for our licensing division. So on the left-hand side, you can see that the number of new licenses issued, the number of renewed licenses issued, the number of individuals that used our online services to renew their license, and the percentage of individuals that renewed their license online. And then at the very bottom of the report, it says total population. Those are the total populations for the fiscal year 2022, 2023, and for the first 2 quarters in 2024. Does anyone have any questions about the licensing report?
Leonard, I do.
Yes.
So
Sure.
how many total licensed dietitians do we have in Texas?
So at the end of the second quarter, we have 8,200 current licensed dietitians. I know you always get excited because you see the number continue to grow every time we meet. So that is the total population at the end of the second quarter for FY 2024.
Very good. Wow. Has that grown for those of us that have been on this board for a long time? That's a nice number to look at. Thank you, Leonard. Do you have anything else for us?
Yes. Does any board member have any questions about the report? If not, I will go to the next item. Under current projects, the licensing work group met on December 18, 2023, and we discussed draft rules relating to education experience requirements under Occupations Code 701.254, qualifications for examination for licensed applicants who do not hold a dietitian registration for the Commission on Dietetic Registry. Thank you to those advisory board members that served on that work group. And advisory board member Irma Gutierrez will give a little more information under item G later on in our meeting. That concludes my report. Does anyone have any additional questions? All right, thank you.
Thank you, Leonard. All right, next, the Education Examination Division, Ann Pascal. Are you on, Ann?
I forgot to unmute myself. Sorry. Good morning, advisory board members. My name is Ann Pascal with the Education and Examination Division. I'm here to give you our jurisprudence update report. Kind of going with what Leonard just said, we have a lot more licensees that are coming to our state and applying for a license here in Texas. And so that generates the up in the jurisprudence exam or JP exam. As you can see, the number has gone up quite a bit compared to fiscal year 2023. And so far, as of March, we had 219. Any questions on that? I have a little bit more information about the JP as we go down to the updates there. So just a few updates for you. The Education Examination collaborated with TDLR's Compliance Division, and the work group met with Compliance, our licensing general counsel, and the Office of Strategic Communication to research educational equivalencies for the dietitian licenses. Later on, our Compliance Division will provide detailed information about the research for you. The April 17th, 2024 meeting has been rescheduled, so I don't have an update on that topic point at this time. But I do have an update on the JP exam. So some of the advisory board members here that are on, along with TDLR and E-Strategies, we worked hard and developed an engaging and interactive course to complement the exam that reinforces the applicant's understanding of the significance of the exam and its content. It also explains on how to access the rules and statutes outside of the examination. And the SMEs created an interactive learning experience with content and scenarios that can be adjusted over time to support different subject areas needs without requiring changes to the question banks. The course is divided now into 4 different modules that reinforces those specific rules and statutes. And we did that to meet the board's objectives for comprehension and licensee behavior. And the new JP exam went live March 13th of 2023. And I'm available for any questions you may have.
Excuse me, are all of the public commenters out of the meeting? Or are they allowed to stay in the meeting?
They should have been moved out. Do you?
I think I see Mr. Bramick still in the meeting.
I don't see him.
I think he just left.
Okay, real quick, Ms. Hall, Leanne Skinner joined the meeting, so if you want to acknowledge her real quick before we proceed with the staff reports.
You
Ms.
bet.
Skinner, can you hear us, Ms. Skinner? You're muted. You just want to pop in and say hello.
Yeah.
There we go.
Sorry to be so late. Thank you.
It's okay.
Welcome, Leanne. We're glad you're here.
Thank you.
And just a reminder, when we speak, we need to be sure and say our name first. I know you're new, Kay, but let's just reinforce this. That's all right. All right. So no questions for Ann? All right. We'll go ahead and move on to the next one, which is the Customer Service Division.
Oh, sorry, I just had one quick update that I just received. That meeting that was rescheduled for April 17th to discuss the human trafficking has been rescheduled for May 7th. So that will happen, and hopefully we'll have an update for you at the next meeting. Okay?
Great news. All right. Anything for Ann before we let her go? All right. Thanks, Ann. Appreciate it.
Thank you very much.
All right. Customer Service Division. Myra Rodriguez. Did I say that right? Myra?
Myra, thank you so much. I appreciate it. My name is, good morning, board members and TDLR staff. My name is Myra Rodriguez, and I am one of the managers in our division here in customer service, overseeing the dietitian program for our staff. Just looking over really quickly at the customer service statistics, our phone calls and emails are listed here. As you can see, for March, we were at 358 total contacts at the start of this third quarter. It looks like overall, in comparison to the fiscal year 2023, we are slightly higher in numbers, but not by much. But it has been consistent like that throughout this fiscal year so far. And I don't have anything else to report. You can just see the breakdown there from the emails and the phone calls that we receive here in our division. And I'm available for any questions that you may have.
All right. No questions. All right. Thank you so much for your report.
Thank you.
All right. Enforcement Division, and it's Shauna Almashuk.
Good morning, board members, and welcome to the new board members. My name is Shauna Almashuk. I'm a prosecutor for the Enforcement Division. I'll be presenting a report for you today. You may notice that we have updated the Enforcement Division's report from our last meeting, and I'll be covering key statistics and case prioritization. At the very top, you have the division's performance measures, which are reported to the legislature. You may notice we've also reorganize the materials so you can compare one fiscal year to another more clearly. And you'll notice that the average time for closing complaints has decreased significantly from last year. The next section is the criminal history review for applicants who may have disqualifying criminal history. As you can see, none of the dietitian applicants were denied licenses based on their criminal history. And these cases are handled by our criminal history prosecutors. The next section details where the Enforcement Division's complaints come from, whether they are from consumers or from within the agency. The top of the next page puts this into a pie graph chart for you. The next section details our caseloads within our Enforcement Division. The orders issued are the end of the road for the disciplinary action where the person admitted that they made a mistake and paid an applicable fine. The penalties and consumer remedies detail how many fines were assessed versus actually collected and shows you the average penalty on these cases. The top of the next page shows the rationale for cases that were closed without disciplinary action. And then the next section details alleged violations at opening. And these are just the reasons the cases were opened on the front end. And then the very last section details the violations which resulted in disciplinary action. The type of cases that we took action on. So as you can see, dietitians generally adhere to the laws and rules. And additionally, today I have some information in your packet about a project that enforcement has been working on at the direction of the Sunset Commission. The Enforcement Division has begun the review of each program's most frequent violations to identify and prioritize those that pose the greatest risk of consumer harm or injury. The goal is to focus our limited resources on the complaints that have the greatest impact on public health and safety in the most efficient way. There is more detailed information in your packet if you're interested in learning more about this effort. Additionally, we're actively seeking dietitians that are in good standing to serve as licensed dietitians that are in good standing with TDLR to serve as subject matter experts to assist our Enforcement Division with complaint case reviews. The subject matter experts review complaint cases generally involving standard of care issues during the investigation stage of the enforcement process. If any licensed dietitian is interested in becoming a subject matter expert, please have them complete the expert witness application on the TDLR website. And once the application is submitted, we'll send a questionnaire to each applicant to complete and return. Documents are screened and contracts are issued to approved subject matter experts. I'm available to answer any questions that you might have.
So Shauna, these subject matter experts, they don't necessarily have to serve on the board. They just need to be licensed dietitians in good standing.
Yes, that is correct.
Is this something that we can promote through some of our professional organizations?
Yes, that is something you can promote, yes.
Like the Academy of Nutrition, et cetera. Okay,
Yes.
well, thank you. Does
Yes.
anybody else have any questions? All right, thank you so much.
Thank you.
All right, our next agenda item is the Compliance Division, and Mary Hoffman will be reporting to us.
Good morning, my name is Mary Hoffman, and I am a program specialist in the Compliance Division. I'll be providing the report for you today. Hopefully you can hear me okay. I had a little bit of technical difficulties earlier this morning. Staff continue to work on bill implementation teams for the medical and health bills that passed last legislative session. Staff also participated in the dietitian licensing work group meetings, which Leonard spoke about earlier, and you will get a report on later on in the agenda item. Coming probably next, and staff continue to work in collaboration with the Office of General Counsel, Licensing, and our Education and Examination Division on conducting research and analysis needed to make recommendations on a possible new non-registered dietitian pathway. For the outreach for our section, myself and Erica Rodriguez attended the Texas Academy of Nutrition and Dietetics annual conference in Houston that happened in April. And our staff also continues to work on the TDLR Health Monitor newsletter. You can always find those newsletters on the dietitian webpage, and you can find those archived newsletters on the agency's main page under TDLR Health Monitor. If you ever have an outreach opportunity for us, we would love to come out and provide a presentation or attend a meeting. Please just reach out to me and we can make that happen. I'm available for any questions if you have any.
Hey, Mary, I think that our conference was in the Dallas area in April.
I apologize for that.
That's all right. That's all right. I just wanted to.
Thank you for the correction.
All
I
right.
believe that was a week where there were multiple conferences back to back. And so
I know you were busy. You were so busy that time.
Thank you for that correction.
But thank you
Any
for
other
attending.
questions?
All right. Thanks, Mary.
You're welcome.
All right. Report from the executive office is from Deputy Executive Director Brandy Myers.
Good morning, Presiding Officer and board members. Welcome to all of our new board members. We're excited to have you. And for those that are still a part of our board, we're very thankful for your gracious attendance and commitment to this board. For the executive office, got a couple of updates, personnel update. First of all, I'm a new face, so I will let you know that I was previously the Chief Financial Officer for the agency, and in November I became the Deputy Executive Director over our Administrative Services and Strategic Response area of the agency. Another new name in the Deputy Executive Director role is Steve Bruno. He's new to the role as well, but not new to the agency. He was our Legislative Director prior to his promotion into the Executive Office. And then Brian Francis, a very familiar name, I'm sure, to many. He is our current Interim Executive Director. So there's been some moving and shaking in the Executive Office, and so those are the new faces. All right, bill implementation update. For the last legislative session, one of the bills that I'm sure you're aware of that was going through the process was Senate Bill 2016. And this Senate bill, its intent was to update existing laws to align with national standards and require applicants to hold a master's degree. This bill was passed but ultimately vetoed by the governor in the veto period, so that did not go through. But as a result, there, as y'all are aware, later on in the agenda, there's some conversations that we're going to be having about licensure. So that was the bill that was relative to your industry that we were watching in the last session. And then as we're talking about session, we're getting ready for the next one. So moving on to the strategic planning update, we are in the process of doing all of our strategic planning. And for TDLR, we don't do just a checkbox task. We don't just get this done and turn this in. The strategic plan is going to go to the Legislative Budget Board and to the Governor's office. And it's going to outline what our strategic initiatives and goals are for the next 5 years. So we're looking at a 2025 through a 2029 strategic plan that we're getting ready to turn in. So what we did is we went to all of our stakeholders, internally and externally, to get information and feedback. And we asked questions like, hey, what is TDLR doing well? And what can we do better? And if you were king or queen for the day, what change would you make? And then we also asked, what kind of industry updates are you expecting, or industry changes are you expecting in the next 5 years? And we did have dietitians present in those meetings. And so that was very exciting that your industry was represented in those meetings. And we did them all over the state, essentially. We did one in El Paso, we did one session in Harlingen, one in Houston, one in Arlington, and we also did our last one in Austin, and that was also a virtual session. So we've tried to touch the corners of the state to get feedback from our licensees and for those that our licensees serve through that process. So I'm sure we got probably over 10,000 comments through this process, which is exciting. So staff here at TDLR are currently going through and sorting all of that information and figuring it out and putting it in buckets. And we are still in the process of putting our strategic plan together. So stay tuned. It is due on June 1st. So the staff are feverishly working to get this thing put together and incorporate the feedback that we've received from all of our stakeholders. So that was an exciting piece, and you should see that coming out in the near future, like almost a month-ish. So that's where we're at. Those are all the updates I have for you. If you have any questions, I'll be happy to answer them.
All right, thank you so much. I appreciate that report. And nice to meet you.
Pleasure to meet you and work with you all.
All right, so we're going to move on to agenda item G at this point, and this is the work group reports and possible recommendations. So the first one was the education and examination work group, and we're postponing that report until the next advisory board meeting. So we'll move on to licensing work group report on the draft rules implementation. And Irma, are you ready to give your report?
Yes. Can you hear me?
Yes.
Yes,
Okay. Okay. We met, the licensing work group met December 18th, 2023 to discuss draft rules related to education and experience requirements under the Occupations Code 701.254, qualifications for examination for licensed applicants who do not hold a dietitian registration from the Commission on Dietetic Registration. Leonard Rivas led us, and Mary Hoffman, Erica Rodriguez, Katie Bryce, and Wendy Palo from TDLR, and the work group members were myself and Leanne Skinner. The issues identified was that the Commission on Dietetic Registration, or CDR, increased its education requirements to a master's degree to obtain a registered dietitian credential effective January 1st, 2024. Senate Bill 2016 88th Legislature regular session 2023 would have increased the Texas statutory education requirements for a dietitian license to at least a master's degree to align with the CDR requirements. However, the bill was vetoed. The Texas statutory education requirements for a dietitian license remains at a bachelor's degree or higher in specified areas of study. The Texas licensing examination is still the CDR examination. TDLR needs to create a new license pathway for applicants who hold a bachelor's degree and who do not meet CDR's new master's degree requirements. This new licensure pathway would allow licensed applicants who do not hold a current registration dietitian credential to be eligible to take the CDR exam for state licensure purposes only. The licensing work group and TDLR staff discussed draft rules that would implement the education and experience requirements under Occupation Code 701.254, qualification for examination for licensed applicants who do not hold a registered dietitian credential. The licensing work group recommends that TDLR staff gather additional information and research other states with similar requirements. That's the end of the report. Any questions?
All right. Thank you, Irma. I appreciate the
You're
work
welcome.
that you guys have done on this.
Thank you.
All right, our next agenda item is H, and it's a discussion and possible recommendations regarding the development of a non-registered dietitian pathway. Mary Hoffman, are you ready for us?
Excuse me, I am here. Can you hear me better? I put some headphones on. Hopefully it comes through. Okay, good. Thank you all. My name is Mary Hoffman. I am with TDLR in the Compliance Division. And I'm just going to repeat really quickly what everyone has been talking about. TDLR has been doing a lot of research and analysis regarding what we can do in order to create a new pathway since the Senate Bill 2016 veto, which would have aligned TDLR's requirements with that of CDR. And since that was vetoed, TDLR is having to create a new pathway for those individuals who do not meet that requirement and do have a bachelor's degree or higher. So with the recommendation from the work group, TDLR has been doing extensive research. We have looked at all of the state licensing requirements for dietitians. We have combined that information into spreadsheets. We've tried to summarize it and analyze it to get a really good understanding of what those requirements are across the different states, as well as looking at the DPD programs, the dietetic programs in the universities just in Texas. So these are Ascend accredited programs. And so what we've done is we've looked at these programs and what coursework they're requiring that need to be completed in order to meet that requirement and get that DPD verification. So we've done the research looking at coursework, specific credit hours that are required in each of these courses, and trying to understand just what the industry is doing currently, if anything has changed in recent years, and what pathway we should move forward in. And with this research, all of the board members should have received this information in your meeting materials, and they were under item H7, I believe, that are specific to the research that we've done. And from the research that we've done, TDLR does come with a recommendation today, and I'll go ahead and share my screen so that you can see that recommendation. And you should also have that on your packets, in your packets. Okay, so can you all see my screen?
Yes.
Okay, so what staff is recommending is while we will still continue to have the pathway for the RD registration for someone who comes in with a master's degree and has a current RD credential, we will still continue to keep that pathway. And what our other option is that we're recommending is for the education requirement. And this is specific just to education. We haven't looked into the experience requirements yet. We're just looking at education only today. And so what we're recommending is, and this language may look similar, this is language that was in the rules, in the dietitian rules back in about 2018. This was language that we had before we streamlined the licensing process and removed some of this language and only required the RD credential for licensure. So this is, we're kind of going back a little bit and using this older language that we had. And so someone who wants to apply for a license with through the non-RD pathway would have to have a baccalaureate degree or higher with a major course of study in one of the following major courses of study, which would be dietetics, human nutrition, foods and nutrition, food systems management, or an equivalent major course of study that is approved by the department. So if someone doesn't meet or have one of those major courses of study, that does not mean that they will not qualify for a license. We then will evaluate it to see if it's an approved major course of study by looking at these items here. A major course of study is defined as a baccalaureate or post-baccalaureate degree or coursework that includes a minimum of 30 semester hours in the following areas. So then we'll break it down, whether it's a major course of study or if it's someone that comes with a different major course of study, but they have this coursework. We will look at that and break it down to see if they meet this requirement. And so that 30 hours would include 12 semester hours that must be specifically designed to train a person to apply and integrate specific scientific principles of human nutrition under different health, social, cultural, physical, psychological, and economic conditions to the proper nourishment, care, and education of individuals or groups throughout the life cycle. Additional 6 semester hours must be from human nutrition, food and nutrition, dietetics, or food systems management. And it can be in any of those, 6 hours in any of those. And then 12 semester hours must be from 4 of the following 3-hour courses. And so that is upper division human nutrition related to disease, upper division food systems management, bio or physiological chemistry or advanced normal human nutrition, food science, or upper division nutrition education. So this is, again, language that was in rule around 2018. I believe it was also in DSHS rule. It may have looked a little different. You should have received in your meeting materials excerpts from the previous rules that include this language as a resource. So if you have questions on what those rules look like back then, you have those in your meeting materials as well to take a look at. And so I'm happy to answer any questions that you all may have. And this is, we can discuss this if you all agree that this sounds like the appropriate pathway to move forward. You can take a motion if you feel like you need additional time to really dive into the research and additional information that's been provided to you. If you have not had a chance to do that, we can postpone this and discuss this at the next meeting. But that will be something that is up to you all.
Does anybody have any discussion items that they would like to bring up with Mary or have any questions about what she just presented?
This is Kay Vavrina. I actually am, I find this to be an interesting solution. I'm kind of interested in what others are thinking. I will say that my one concern after reviewing the information from the um, the public speakers today is that I don't see a lot of evidence-based practice. I don't know how others are feeling, but that is my one concern.
This is Kawana Young. I think that it gives a lot of options.
So a little bit of information on the reason why we're moving or recommending this language is if you look at the resources provided to you, some of the research specifically on the DPD university coursework and credit hours in summary. So these documents have laid out what each of the DPD university courses require. It lists each of the courses, all of the credits that they are required to have in order to complete this program. And when looking at all of the university's requirements, and then looking at who requires the highest number of nutrition courses, who requires, or what is the highest number of requirements in science versus the low numbers. It ranges. It is a wide range of requirements, university by university. So if we say like just straight across the board that, okay, we'd like to have at least 25 credit hours in nutrition and 20 or 25 in science. There are many universities that are not going to meet that requirement. So this is a way for us to be able to look into each of those course descriptions to find out where they fall. And it gives them more flexibility to be able to meet these requirements instead of, because that was a consideration saying, okay, what about us requiring a minimum nutrition course of coursework, a minimum of science coursework or math or whatever. But if you look at the state's, the university requirements, they vary. For nutrition, the high is at a 55 and then the low is at a 12. So there's a university there that requires 12 nutrition course hours. And then if you go into science, there's a university that requires 39, and then at the low, there's a university that requires 6. So
yeah, it's this document, you guys.
Yes.
Yeah,
Okay,
so if
just in
you,
case.
our thoughts were we have to be able to give flexibility and really look into the course description to identify best what the course, where this course fits and what it's going to meet as far as our requirements. And looking at this language that we had in there that really gives us the ability to look at each course individually to find out where it's best placed. But we are open to recommendations. That's why we're here to have this discussion. If you all would like to make recommendations or changes, that's why we're here.
Is Susie still on? Janet, is Susie still on?
Yes, I'm still here, and I'm thinking, thank you very much for all
That's
that.
right, because Susie is our education expert, so I'm curious to see what she says.
Thank you for all of the hard work that
This is Irma. I'm sorry, Janet.
You're going to get in trouble, Irma.
I know. I'm always in trouble, Janet.
And I was just sitting here looking over all of those courses and coming from multiple institutions over my lifetime. I know that how different schools classify different topics is going to have a huge variable in play. And so looking at it, you kind of look at some point there needs to be a really, in my opinion, straightforward, this is what we mean by nutrition. Because at some schools, nutrition can be food prep. It can also be, animal nutrition. And so it's a matter of how do we specify specifically what it is that we think is important with relationship to this practice. At least that's my take on kind of looking at things, because I know people look at it in a whole lot of different variables. In some schools, nutrition is classified as a pure science. In other schools, it's a social science. So again, we have to look at the specifics before I think we can classify it all. And I think you all have done a nice job with descriptions that you have put into place so that it leaves it up, in my opinion, to individual evaluation of what those courses actually are and not what their title necessarily implies or implicates. Excuse me. And this is pollen. So does that answer what you're talking about, Irma?
Susie, well, I have a question. This is Irma again.
I know.
It's big difference on the universities versus the ones that have the didactic program and the ones that have just the DPD, right?
Yes.
Okay.
And
I
there's
just want to
not,
make sure.
yeah, there's differences in how you put those together and classify them. And wondering too, is this opening up for what we heard discussions earlier today? Because when you kind of look at, is it just that we're trying to get these into LDs? Is that what the other group that's looking at these, this option, is that what they're looking for, to go CNS and LD?
Right.
And that's kind of like, a lot of this is going to fit nicely into maybe what they've already experienced. Now, my screen's not showing if we have experience on there, and I don't know what that would entail.
This is Irma again. Mary, I have a question. What would it do? What is it going to do for us with TDLR for the future? Are we going to go back to the legislature with the master's thing, or are we going to let it go since it was vetoed?
From my understanding, we've heard the governor loud and clear with the veto, and that as an agency, I don't believe that we will try this next session. I think if that happens, that would have to go, from an association or another route. But for TDLR, this is what we're working on and focusing on, and think that this is what we're going to have for the future, is this new pathway. So I can't say if next session if someone will file a bill and if, how well that bill will do next session. But right now, TDLR is just focusing on creating this new pathway.
Okay, thank you, Mary.
You're welcome. And as far as experience, here on the document, I just listed what our current
I can see
statutory experience is. Now, experience is another discussion. This is just what statute requires. We are not, that's going to be the next step in this. Right now, we're just focusing on what the education language would look like, and then we'll continue to meet to move forward with the experience piece of this. So this is just based strictly what statutory language is, and then.
Okay, thank you.
Mm-hmm.
So this is Janet. So Irma and Susie, so when you see the descriptions that the recommendations is from the staff to go back to the 2018 language, do you two feel like this is the direction that would encompass taking care of all these different coursework, when you can't classify the classes necessarily, nutrition might be mentioned, in different areas. Do you all think this is the right direction that we're going in? Going back to the 2018 standards or guidelines.
Janet, can you remind me what the 2018 standards were?
Well, it was what she's got up on the screen.
Okay,
It
okay.
classifies the number of hours in each category. Since we can
Right.
clearly see the universities are calling things differently and classifying them differently,
Right.
but at least we can say, you know, is your degree in human nutrition or is it in food and nutrition, or you know what I mean? This gives us a
Right.
little bit more of a guideline
I
Right.
think
to
this,
help
I do think
when
this
we're
adds
trying to
specificity.
converge, not just an RD, but people that are non-RDs, you know, to
Right.
see if they would qualify to have a license in the state of Texas.
Would they still be called a licensed dietitian?
Mm-hmm.
Yes. They would not have the RD credential, obviously,
Yeah.
but, you know, for example, we heard from some CNS people, and so maybe it would be CNS, LD.
And that's what I wondered. If that is that, honestly, this looks back to the future to me. I mean, it's kind of like we've been here and here we go back. So there was definitely some value in that when we needed to do it. And I have 4 children, whatever the verb is there. But looking at that, I know that they're going to work things in their way. And sometimes it's just going to be a manipulation process. And so this may be the best way to get around what the veto was, and we leave it open then for a future to go back in maybe not this next session, but the following session.
Correct. I agree with Susie,
would be my
Janet,
thought.
Ms. Irma.
I mean, this is Kay Vavrina. Why aren't we, instead of looking at a pathway for people who are not RDs to become licensed, why aren't we looking at a way to protect our license instead? Why are we trying to let more people do our job? That's my question.
That's a very good question from my perspective. Because there's that selfish part of me that I remember fighting really long and hard to get respect for that RDLD.
Yeah, I think honestly that's more the direction that we need to be taking. That's my opinion.
That sounds like something that would require legislative change. If you're referring to title protection versus practice protection.
Yes.
And so right now, the issue that we have in front of us is our statute requires a bachelor's degree or higher to get a license. So we need to be able to have a pathway for someone who comes to us and says, I have a bachelor's degree and I want to apply for a license, but TDLR doesn't have a pathway yet created for them. This is the work that we're doing, is trying to create that pathway. So because our statute requires the bachelor's and not the master's degree.
But doesn't our statute require you to have an RD credential to become licensed?
That is in rule, but that
No.
is not in statute.
Hi, this is Letty Moreno Brown. Kay, I agree with you. And not only that, you know, for us that have the registered dietitian, it's also misleading to the consumer.
And I think I'm just going to, this isn't my opinion, this is just what the others are saying, is that they feel like they are as credentialed, if not more credentialed, than an RD is. And why should they be denied the licensed dietitian? That's the other side of the discussion.
I think
Wendy has her hand up. I don't know
if she's still.
Yeah. Just thank
I
you.
mean,
This
I
is
think
Wendy
there are
Pellis.
plenty of people who think that they know a lot about nutrition who didn't even go to college, who think so.
But see, but they wouldn't be
that
able to qualify. They wouldn't be able to meet these standards that are up on the screen.
But in Texas, they can call themselves a nutritionist. That's the problem.
Exactly.
And
It's always been the problem.
That's a whole different discussion, because that is, you know, it's a title act, the title of licensed dietitian.
And not a practice act, yeah.
Right.
We don't control whether they call themselves a nutritionist and are less or not qualified. It's only if they
I
call
understand
themselves
that.
a licensed dietitian do they fall under the guidelines of our rules and the statute. So that's a whole different discussion. This discussion is if we're not going to have the masters in the way that our legislative, bill and everything is, then how do we handle that with this? And this is the pathway that after much research with the team and the staff, this is the direction that they feel is the best way to go. It's up to us to have this discussion and determine what else do we need to do. Are we satisfied with this? Are we willing to put a work group together and do more research on it? But the nutritionist issue, that we can table for something different, but that's not right here for this non-RD pathway.
Janet, this is Irma. I'm curious to hear what Wendy has to say because she wanted to say something.
I saw her popping up.
Yeah.
Sorry. Thank you, Wendy Pello, Senior Assistant General Counsel. I was just going to, you've already kind of hit on some of this tight distinction between Title Act, Practice Act. We're also working within the structure of the dietitian statute. And so the dietitian statute, as Mary with experience, is, a bachelor's or higher. So we have to recognize a bachelor's or higher. And again, this is for a licensed dietitian license. Those first 4 items, those degrees are in the statute, and the statute also says or another equivalent degree determined by the department. And then the following language about the 30 hours and the breakdown, those were, making determination what it's an equivalent degree. The experience part, which will need more research, but the experience part that's on your statute is again out of the statute. And so it's, an internship or pre-planned professional experience program in dietetics practice under the supervision of a licensed dietitian or registered dietitian. So we're doing rules to help implement that, but we are still confined to the scope of what the statute is. And so that may help, narrow your focus of, what you're looking at. But we, with the veto proclamation, which you had included in your materials, we need to find a pathway for a person who's, gone to school, had a dietetic type of degree, dietetic practice type of experience, but only has a bachelor's degree, how they can qualify, because the department will then need to review all this and qualify them to go take the exam.
Yeah.
There still be the pathway because the statute already allows the exam to be waived for somebody who's already taken the CDR exam. And when they've taken the CDR exam for the registered dietitian credential, they've already met the education experience that they've taken the exam. So when they show right now that was they've shown up, to apply for a licensed dietitian, dietitian license with TDLR, they've shown that as proof and that's qualified them. This is now we're needing to build a pathway for someone because the CDR requirements have moved up to a master's with someone who only has a bachelor's degree or doesn't have a CDR registration, current CDR registration, having them be able to become a licensed dietitian. So, but yes, this is all a good discussion, and we just wanted to interject that we're still need to remain within the scope of the statute on that in terms of kind of where we go and what the experience can be and what the education can be.
I think with much more description or interpretation of what is described, we're really kind of opening it up to those individuals to go ahead and become licensed. But is there any place in there that we can also suggest advanced study, not necessarily upper level, but moving into a more advanced realm, which would probably put them closer to that master's degree?
How would you define that, Susie? This is Janet.
I know I was going to throw a word
Only
out.
because what's already in there is baccalaureate degree or higher.
Or higher. I know, I see that, which I think makes it an open thing. And one which we would push if we were in the education field. I would expect.
This is Kay again.
Yeah,
Or would we be able to, a lot of master's programs require research. Would we be able to put some kind of nutrition research requirement?
and a lot of undergraduates require research as well. So yeah,
I mean, that would be a little bit more advanced anyway.
I'm just kind of thinking it might go into that 12th semester hours specifically designed to train a person to apply and integrate scientific principles, blah, blah, blah. That would be a reasonable place to have research because it is a part of learning how to apply the research. And whether that's fully doing it or just applying it, that might be open enough to kind of look at it. Because somehow we need, in the bachelor program, we need to make sure that they think, and it's not just a matter of whatever is pending on social media or wherever, that's the answer, but that they need to think through from, have you done the research? Have you looked at that? Do you really understand? That's my thoughts, but that I'm a perfectionist sometimes, sorry.
So this is Janet. So I'm looking at the coursework and the credit hours, how, the summary, and the team contacted all the universities. Did you see the stack, like 160 pages of information?
Mhm.
The difficult thing with trying to add something like research is, how is it going to be shown by the university or by the schools as a research class? And do we really have the capability of analyzing that from our position or from TDLR's position, when each university will mix it into classes in a different way?
And that's what my issue is that somehow we get that research implied that it's going to be incorporated, not necessarily with a name, but that activity is happening. And that might be in that apply and integrate scientific principles.
Well,
Just a
Susie,
thought.
this is Janet. Susie, we still would have to evaluate that.
I know.
And if we have 8,000 licensees right now, and if we open this up for the non-RD route, there's many more that will be coming. And that means somebody would manually have to, for each person, figure out where their research hours
Show that
were
with that.
in
And
their
whether
coursework.
research hours or a research skill.
Mhm.
So I don't know. That's me and the perfectionist that tends to show up every once in a while. I apologize to all the board members for that.
No, I mean, I think this is great discussion. I understand that would be great, but I think the logistics of executing it would be quite difficult.
Janet, this is
Most of
Irma.
sorry, Irma, go ahead.
So what do we need to do today? Do we need to make a decision, make a recommendation, table it, get another work group? What is the board thinking? Go ahead, Kay. I'm sorry.
This is Kay. I was just going to say, aren't most major universities and nutrition programs accredited by Ascend anyway?
Yes.
I mean, am
They
I
should
making
be.
a huge generalization? So couldn't we say an Ascend accredited program, or an accredited program, a program accredited in nutrition? I don't know how I'm trying to say it, but surely there's some way that we could figure it out. But that if it's accredited, then we would be able to include it. And then any other thing, I would imagine the percentage would be small enough that we could individually look at them. But if the program is accredited by Ascend, then it would meet the requirement. Am I making sense?
But Kay, this is Irma. Isn't Ascend now requiring the masters?
Yes. No.
Yes.
No, you can have an undergraduate one, can't you?
They are, but they're undergraduate program. I don't know. I guess that doesn't make sense. It would have made sense before they had to go and change everything.
Exactly. Thank you, Kay.
Oh.
So the ultimate intent is to protect the state of Texas from people that are practicing without proper credentials or giving misinformation. It's for public safety, ultimately.
Right. Correct.
So being this is not my opinion, but just being the other voice when there are other people that are accredited in a different avenue, but as they said, had 1,000 hours of experience, had a master's, had all this other stuff. Are we really just trying to protect registered dietitians, or are we trying to protect the state of Texas?
My intent is to save Texas. I mean, and I don't, and this may be a really big way. I wouldn't be adverse to going in this direction, at least as a way to move forward. It's kind of like go around. Yeah, because I look at this, I see all females, and I know females are particularly good about going around and figuring out which way is going to work best for me. And this may be one of those go around the pathway. And I am not that person, but anyway, I'm voicing that other opinion.
Mary, Irma had a question on the table what is our next steps? What should we do? And I'm hearing somebody's got an echo. Does somebody have two speakers going on in their office at the same time? All right, Mary.
Trying to work on that in the background. I apologize. I'm trying to mute as we go.
Thank you.
Folks are turning on their mics. We're trying to get them as they go. I apologize.
So our next step, Ms. Hall, is if you and the board members agree with the recommended language, you would take a motion and a vote, and then this is not the exact language that would be enrolled. We would take this, make rule updates, and then bring it back to the board at a later date. So this is just the language that we would base the rule changes off of. Also, oh, go ahead, Wendy.
No, I was just, oh, that's right. Wendy Pello, Senior Assistant General Counsel. The other options, if you could send it back to the licensing work group. You're not going to be able to send it to another work group because, again, of the walking quorum issue, because we've already discussed rules with that licensing work group. It'd need to go back there. They only have 2 members, so if you wanted to appoint another person to the work group, you still have that without hitting the quorum issue. Or if you want to have this full discussion, if you need more time to think about and digest it, and have a full discussion again at the advisory board, schedule at another advisory board meeting and have more discussion there. So after you have time to review the materials and study that more if you need more time. So you've kind of got a variety of options on the table based on where the advisory board members feel comfortable. I don't know if that helps or not. You've got some options.
That helps a lot. What is everybody thinking?
Janet, this is Leanne Skinner. Can you hear me?
Yes. Yes. Thank you.
I'm not comfortable with the way it is now. And I appreciate that it's taken a lot of work to get there, but I don't think it protects us. And the bottom line is, we've all strived really hard for many years to be licensed in the state of Texas. And I don't want to water it down with somebody who may not come in with the same kind of understanding of what we do and how we protect the public. So, thank you.
Thanks, Leanne. Okay, we can't hear you.
This is Kay. I'm happy to join the work group if you guys need help.
That'd be great, Kay.
You are exactly who I was thinking would be good there.
Yeah.
Yeah, and you
Any
have an
other?
agenda. This is Wendy, and you have an agenda item later on, so for
Yeah.
appointment and reappointment work groups, so you can make those changes there as well.
Thank you.
Wendy, how many people can we have on this work group?
You can have a maximum of 4 on the work group. Of course, that when we do have the 4, that would leave you off in terms of communication, so that we just bring the work group reports back directly to the advisory board. Just because if we brought anyone in, we'd hit the quorum.
Gotcha. Anybody else have any feedback?
Hi, this is Letty again. I was told there's a quorum for this meeting, so I have a work commitment coming up in 4 minutes, and I also will volunteer if needed.
To be on the work group?
Yes, yeah, Janet, sorry, yes.
All right, so it sounds to me like what we'll do at this point is enlarge the licensing work group. And then we'll do that in the next agenda item. Am I doing this right, Wendy? All right,
Yes,
so
sir.
we will move on from this agenda item. And then we'll go to appointment and reappointment of work groups. And Helica will guide us through that. But it sounds to me like I heard 2 different people volunteer to want to be on the licensing work group. All right, and Helica, it's all yours.
All right.
And Letty, we understand if you need to pop off.
Yes,
Thank
she
you.
needed to leave. Okay, so we can add 2 more to the licensing work group, and I heard Kay Vavrina, is that correct, would like to be on this one?
This is Kay, yes.
Okay. So according to Wendy, we could have 1 more if somebody would like to be on this one. I know Letty
Letty.
offered. Okay.
Letty.
And I know we have a couple new members, so Kay's on there. So okay, good. All right. And okay. And we do have a vacancy for the standard of care work group. If anyone would like to be appointed to that one.
One of our new members, maybe?
Mm-hmm. So we have Miss Kaczynski or Miss Young.
I'll be on the standard of care work group. Kawana Young, I'm sorry.
It's so hard, isn't it?
Okay. And is everybody else okay with the work groups that are on for enforcement? We have Miss Weems, Miss Skinner, and Miss Moreno Brown. And for licensing, we have Irma, Kay, Letty, and Leanne. For education examination, we have Susie, Irma, and Grace. And for standard of care, we have Janet, Kawana, and Miss Brown.
Are you missing a new member, Angelica, somewhere?
Well, we could put someone somewhere else, yeah, since we can have 4. Ms. Kaczynski, is there a work group that you would like to be on? Not the licensing work group, unfortunately.
I am happy to go where you place me.
So maybe let's let Letty's on a lot of committees. Since she's just moved to this other one also, maybe pick one of the ones that Letty was on, and we'll just transfer
either
her.
maybe let's standard of care or the enforcement work group. Do any of those appeal to you?
I'll take enforcement.
Yeah. Okay. All right. Okay. Awesome. All righty. I think we're good.
All right. So I have a question to the group, maybe to Wendy and Angelica. Knowing this is such a hot topic right now, is there a timeline that the advisory board can encourage the work group to have something done by? Or does it not really work that way?
Wendy, I don't believe there's a timeline, correct? So it could.
There's not a timeline, but we can based on your directive, if you want the staff to meet with the licensing work group immediately and work as quickly as possible, yeah, we can take that directive.
I
If
mean,
there's something you want us to have it by a certain date, and then we can come back for full advisory board, we can do that. Especially if we're coming back with recommendations without specific rules, we have more flexibility. If we're coming back with specific rules, then we have to have preamble and fiscal analysis and all the reviews done before we would come back and present formal rules. But if we're coming back like today and presenting kind of recommendations that aren't in rules, we could come back quicker.
Yeah, I think that's what recommendations, because we had a very good discussion. A lot of people have, we're trying to represent all dietitians. And so this will give the board a little bit more time to interact and get an idea. And then we'll have the work group, really look at all the different options. So maybe that's what we should do, is just bring it back to the board and for more discussion.
Oh, so you would like to actually have more discussion at the full board level before having a work group instead of having
I
a work
think the
group?
work group should come, if possible, have the work group do their work, come back and have us not necessarily have rules to present, but maybe discussion and a possible rule. Does that make sense?
Yes.
Yeah,
And
we definitely have a
Janet,
discussion with recommendations. Having, you all will have more time to look at the research we provide, but the work group will look at that as well and come back with more details about what the education requirements may be, the experience requirements, which are will still need to do, so that we can come back with the experience requirements as well. And based on where the board wants to go with that, can immediately build those into future rules.
Excellent.
I don't know if this is Wendy Palo. I don't know if Leonard is still on the phone, but we'll on the call, but we'll make sure the licensing team reaches out and gets in touch with all the licensing work group members and starts setting up meetings to have further discussions.
Yes, Wendy, I'm here. Leonard Rivas,
Okay.
Licensing Division. I will reach out and try to get that meeting scheduled as soon as possible.
Right.
All right. So we move on to agenda item J, recommendations for agenda items for the next board meeting.
So we have, I guess, an update from the licensing work group and more discussion on what came out of that work group is what I have so far.
This is Wendy Palo, TLR. We should also have a work group report coming out of the E&E work group that was postponed from today. So that'll be on the agenda for next meeting as well.
Thank you, Wendy.
Anything else anybody wants to put on for the agenda? All right. So next we'll move on to agenda K. And so this is the time and date for the next board meeting. And so Angelica will do what she's done for us in the past, where she sends out a poll and we poll for the dates to see what the best dates are in everybody's calendar. All right, so we come to the end of our meeting. Do I have to have a vote to adjourn the meeting or just adjourn it?
You can just adjourn it.
Yeah,
Okay.
I'm sorry.
All right, so we will adjourn this meeting at 12:04. Thank you all very much. Good discussion today.
Thank you.
Thank you all.
Thank you, members, and thank you, staff, for everything you've done.
Thank you.
A lot of work
Thank you,
you all have
everybody.
done.
Thank you. Bye.
All right, take care.
Bye.